Welcome to another episode of Preparing for the Unexpected. I'm your host, Alex Fullick, and as always, we like to talk about things related to disaster recovery, business continuity, crisis management, COVID, resilience, and anything that's applicable to those areas. Anything that helps you, your organization, or your community plan for and respond to and overcome adverse situations. As longtime, even viewers now, because YouTube's been around for a while, and listeners on Voice America, you will recognize my next guest. We've met for a year continuously now, to talk about COVID and the latest happenings. Regina Phelps, welcome back.
Alex, it's our anniversary, our year anniversary of COVID.
It is. I wish it wasn't such a.
Here we are. What can you say? Here we are.
Yeah, I can't say Happy New Year because it is the first time I see you.
That's right. Happy New Year. That's right. Yeah. It's our first time seeing each other. So
that's right.
We can do
that. And now the bad news.
Yeah, let's just dive right in and talk about the bad news, right?
Well, you said it, a moment ago. It's been a year since the first case was identified in, I think you identified where too? In Washington.
Yes.
A few days ago. So how have we been since?
I sometimes I feel like that not only is this Groundhog Day, I am sad to say that I'm not going to be able to deliver you a great deal of good news right now because of what's going on. And so I think I'm going to frame our conversation to be essentially what I call V2, variants and vaccines. And so that's what we'll be talking about today.
Well, and I got to give you my update.
Yes, please.
For Canada, we'll start off on ours because I kind of know where yours might be going. So
yeah,
I'll give you an idea of what's happening here up in Canada. Our cases, I got this sheet in front of me with all this on it. So our cases are up to 748,000, roughly around there now. Our deaths are roughly 19,000. So unfortunately, that's been going up. They're both heading in the wrong direction.
Mm-hmm.
A couple of other interesting points, though, that in the UK variant, and I know we're going to talk about that later, the UK variant was discovered in a long-term care home in the city of Barrie, which is an hour north of Toronto.
Mm-hmm.
One of the workers there apparently came in contact with somebody who was traveling. And now there are a couple of dozen people infected, if I'm remembering correctly.
If there's a couple of dozen, there's a lot more.
Yeah, in this, a long-term care home, and now all of a sudden, this person, has spread it in this home. The government, the federal government, is now hinting at quarantining people for two weeks at hotels for anyone traveling, which really, our border is supposedly closed,
That's what I thought.
But apparently you can fly. So they're thinking.
I guess that's not a border.
It's
a cloud. It's a cloud. It's a cloud.
And so they're thinking of now anyone that is traveling that comes into Canada, you're quarantining in a hotel for 14 days. They're only hinting at that, that is not exactly what's going to happen. What else is interesting? In Ontario now, the provincial government, when it comes to schools, every 2 weeks, they're taking a check to see when kids are going to go back. Right now, it looks as though for, I think I've mentioned before, the province of Ontario is massive. California easily fits in our province here. If I'm remembering my geography right. And it's kind of right now split in two, where about 3 hours north of Toronto would be the cutoff, and everything north and west, which is massive in itself, like California, big in its own. Their schools go back potentially in a week, but they're reviewing that to see if that's even possible. In everything south of that border, Toronto, Windsor, Sudbury, Barrie, which I mentioned, our capital, Ottawa. Right now, schools are not opening roughly until mid-February, but in another week or so, they will take a look again to see where the numbers are and maybe keep moving it. So already, what was supposed to have been just 1 week in January is going to be about 5 or 6 weeks already that kids aren't going back. Staying on the schools, another wonderful piece of news. Just a couple of blocks away from where I live is the University of Guelph. And most of the students are learning online, but apparently roughly 50 of them thought they would get together and have a fun little old time. And now they're
college students doing that. That's shocking. That's shocking.
And now there's 32 cases of coronavirus out of this group, of which, who knows who they're spreading that to.
Right.
If these students are living with other roommates, in other places, and spreading all that on. So that was not too good. And was there anything else? Oh, yes. And if I go in the other direction, in the city of, I believe it's Waterloo, Cambridge, Kitchener, there's a couple of churches there that are now upset because people should be able to worship. And, I understand, how people feel about that. However, they are now breaking the rules about gatherings, and they're bringing together all these people for worship, saying that, we should be able to do that. Meanwhile, a lot of these people that are going are the elderly and the ones that are getting sick.
Right.
So
it can't go well.
So that's not going well. Priests and whatever title you want to give them, they're supposed to be community leaders, and to me, that was disheartening to hear that. That, hey, let's ignore the rules, for your safety and life. Come and gather and worship, and then have people getting sick. So, it's not going well right now.
We've had that same exact thing in different states here in the United States as well. And it is disappointing when you think about somebody being a community leader and not following those rules. And then often there have been super spreader events that have occurred in those environments, as churches, places of worship, because people are singing and, in very close contact with each other, and often for a protracted period of time.
Yeah.
Well, I am sorry to hear that, because you guys have done so much. I mean, the U.S. continues to be a mess, but you guys have done so much better than we have. And I saw that the numbers were going up there. So I was going to query you about that. So thanks for that update. I really appreciate it.
Yeah, I wish I could be happy with that update, but
I know. Well, you're not us. I mean, that's the good news is that we are the United States remains in, the number one spot for both cases and deaths. So we are just ramping along. We just hit 25 million cases. We hit 400,000 deaths 5 days ago. It's already up to 420,000 deaths. So you have 19,000 deaths. We went through 20,000 deaths in 5 days here in the United States, to give you a sense of how bad that is, right? I mean, that's pretty chilling.
And almost a year.
Right. And if you look at our numbers, and so I was this morning, I've been on calls with clients since quite early this morning, having the same conversation I'm going to have with you about our overall condition and where we're going. And I think it's one that when you look at the numbers here in the States, what you'll see is that we were at very, very high plateaus. I mean, we got up to having 400,000 cases a day. Just think about that compared to yours. And we were having 4,000 deaths a day. And then we are now falling off of that really high peak. But this may give people a false sense of security because we're going to start going up again. And part of my intent of our time together today is to really talk about that. And that really has to do with the variants. So I want to talk about that first because that really then ties into vaccinations and other key things. So let me first of all explain about a variant. So a variant by its very nature is obviously a mutation. So viruses by their very nature mutate all the time. They're very sloppy in reproduction, and so they're constantly having pieces and parts that aren't right. The vast majority of those mutations go nowhere. So it's a mutation, it simply dies in the body of the person where that mutant virus has occurred. There are now, though, however, something that are called variants. And so what's the difference between a mutation and a variant? A variant is a virus that has become successful at adapting and spreading. So that's when we begin to call it a variant and simply instead of just a mutation. Now, variants, the ones that we're seeing right now are a little unusual because they have a lot of changes in them. Many times you'll see like 1 or 2 or 3 changes on the virus in its structure. But for example, the one in UK has 23. The one in South Africa has over 20. All of them have a lot of different mutations, which is really unusual. And scientists are beginning to say that the reason we probably have this wide number of changes in these variants is that very likely that virus was actually in a person. And perhaps that person was immunosuppressed and couldn't really fight off the disease as well. Perhaps they had gotten some monoclonal antibodies. Perhaps they had actually had the illness maybe once before and got reinfected, but their immune system wasn't really good at fighting it off straight away. So the virus in that person kept changing, kind of like starting your car over and over and over again and changing, and it would change again, it would change again, it would change again, it would change again, until it got really good and then was able to actually exit that person and become successful as a variant. And by that, success means that it can transmit itself from one person to the next. Now, variants essentially have kind of 3 things that we look for. One is transmissibility. Is it successful to be able to be transmitted? And is it more infectious? That's what you see in the UK variant. The second thing we look for, is it more deadly? Meaning when you get that particular strain, is it more deadly? The UK variant is also thought to be that way now. Over the weekend, they released some studies about that. And the last one is, when you look at those 3 things, is do our vaccines or the monoclonal antibodies work in this new version, this new variant? So those are the 3 things that scientists look for when they look at these variants. There's getting to be quite a few of them now. And so I'm going to just talk about a few of them. And I know that we're going to approach our time frame here in just a moment, but I'll talk about the UK one and then we'll stop. The UK variant was first discovered in September, really became scary for them in November. It takes they discovered about 4 to 6 weeks before it really takes off. And by 8 weeks, it becomes the primary variant. So in that particular case, what happened is that it is now taken over and it is the primary virus that is successful in the UK. And it has pretty much reached all of Europe. It's here in the United States. It's also in Canada. It is much more infectious, between 50 and 70% more infectious. And in recent studies over the weekend released, it also is more deadly. But it's also, frankly, more deadly, Alex, simply because if you have more cases, you have more hospitalizations, you have more deaths. So it's more deadly simply by a numbers game. And that's all it is at that point. But it is also more deadly in its own right as well. The good news about the UK variant is that it is still successful, meaning that the new vaccines, the Moderna and the Pfizer, are still effective. And the monoclonal antibodies are effective. I can't say the same for the ones from South Africa or Brazil.
And I know we're going to touch on those in the next segment.
Yes, we are. So now the UK variant is in Canada. Is it the one that's driving your case count right now?
I don't know if it's driving the overall case count. I don't believe it is, because I'm still hearing reports, the variant has been found here, it's been found there. So I think it's still sporadic right now, but with the like my update with the Barrie long-term, the City of Barrie long-term healthcare facility, it's once it takes hold, it seems to be, as you
Right.
described,
Very successful.
it's being,
Right.
yeah, very successful. I don't know another way of saying that, but
Well, it is, right? It's all about, can you live to spread to another person? That's what drives a virus.
Yeah, and unfortunately, but it's still sporadic here and there. But if it keeps going the way it's going, then I think you're right. It's going to be the predominant one here eventually. Unfortunately, that's just the way it's going.
Right.
Regina, you started talking about the variants, and you gave us an update on the UK one. Now, how about you said South Africa, and I think there's another one too that.
Oh, actually, there's quite a few. I think it's going to be like a whack-a-mole kind of situation.
Ooh.
So the UK variant was the first one, and let me just stop and say one thing, Alex, and that is that last year there was sort of one big mutation that occurred with the virus when it split and it went to Europe. So there was the Asian strain and then the European strain. But then, surprisingly, there wasn't much difference. There was very little change in the virus for those two groups all of last year. So we were kind of thinking on some level that, wow, we missed the bullet, right, of having something that's frequently changing like influenza. But no, so what we're now into really is the year of the variants is how I would look at it.
Well, what trigger you got me thinking now? What triggers these variants? Is it the air? Like Northern Europe has different air than Southern Europe. Is it the food?
Nope, it's not at all. It's none of those things. It's basically what happens when it gets into a person, and what happens is if it gets sort of stuck. Is the example I gave earlier, is that it gets sort of stuck and it keeps reinventing itself and then it comes out. And so that's what happened in the European strain, and why, in case you remember, Italy had such a devastating effect and so many deaths. It was because of that successful mutation that had occurred. But we talked about the UK. I want to talk about the one in South Africa, which is very similar to the one in Brazil. It has not as many mutations, about 20, but the mutations are more concerning because they really are in the spike protein. Now, if you remember what the virus looks like, right? It's a round ball with all these spikes all over it, and that's what allows it to come into your body, penetrate one of your cells, get in and begin to reproduce. So the spike protein is where all of the vaccines are aimed at. When you make a drug, you have to aim it at where you're going to kill the virus or the bacteria. It's aimed at the spike protein, and so are the monoclonal antibodies. So the big concern when they saw the changes in South Africa and the Brazilian one is that, oh my gosh, will the vaccines still be effective? So recent studies by both Pfizer and Moderna, those are the two vaccines that are now being used in many of the developed countries, those at this point are still believed to be effective, but not as. So Moderna today announced that they were going to issue a booster that will probably happen in 6+ months. It will require them to reformulate the vaccine, which is simply a chemical recipe, but then it has to probably be tested again in all of the different nations to make sure that there are no particular issues with that. But that's already happening. Now, there's a whole new set of variants that are coming out of the United States. My state, California, there are two. One of them was a variant that was originally found from Denmark that ended up here in Northern California. And now there's also a second one, which has been decimating Southern California. That particular variant has quite a few changes as well. It's thought to be very transmissible, and has certainly resulted in Southern California with a large number of deaths. So LA in particular has been ravaged, just like New York was last year. They have over 3,000 bodies that are stacked up in freezers that they haven't been able to process. And in fact, they just recently, and this is just so horrifying, they had to actually change the air quality standards in LA County so they could do more cremations. They have so many bodies to process. It's just horrifying. So the thing about these variants is that, and now they're starting to sprout out all over, as I've said to all of my clients, is that you have to really rethink what your return to an office is going to be, because remember, this is aerosol transmission. Indoor spaces are not going to be good. I think everybody was sort of hoping and praying that by the summer, the vaccine would be able to get us to a new place. And kind of overarchingly, I have said to all my clients, I think you need to think about the fall and maybe even the early or late winter. So we're into the end of 2021 or the beginning of 2020. I don't think, at least in the United States, that people are going to be able to safely occupy an office anytime soon.
I'm going to go back a step, because I was thinking with the Spanish flu back in 1918.
Mm-hmm.
Were there a lot of different variants that you're aware of that came out of that one as well? Like,
That's a great question.
Are we experiencing the same thing that they did, but we may have not realized that part? Like, we didn't take it into account this time around?
That's a great question. The answer is that it's really impossible to know that, because of course there was no genetic sequencing back there and there really isn't good samples. But let me just say something about influenza, because you raise a really important issue, Alex, and that's this. Influenza is really, really different than the coronavirus. And one of the key things to remember about influenza is it likes really cold weather and it likes dry conditions. So think of being in the winter, you're inside, you have the heat on, and it creates a drier environment. And so it spreads when people are close together and in a dry environment, but it's very seasonal. And what happened in 1918 and 1919 is that it would go into a community, it would blast through a community, and then in about 8 weeks, it was gone. It did not come back again till there was another seasonal change. And so the difference between influenza and the coronavirus is that in the coronavirus, we are just hard on all the time, anytime. People are not behaving themselves, not masking, not distancing, etc. That's all the virus needs, is a vehicle. And it doesn't matter whether it's hot and humid like Georgia or Florida in the summer, or it's freezing cold. It's happy in all environments. So it's really different from a transmission perspective than influenza, unfortunately. And I think because we never had a coronavirus pandemic before, no one really knew what to expect. And so there was a lot of speculation that it would go away, in the summer. Didn't change at all anywhere in the world. Yeah. So that's the unfortunate thing. So yeah, we can't compare it to the 1918 flu at all.
I was just kind of wondering if, with all these variants that are now getting identified, hey, did that happen back then too? Should we be surprised or not surprised? But you kind of answered that.
The thing about the variants is that here in the United States, and I do not know about Canada, but in the United States, we have done an abysmal job in doing genetic sequencing. So, and we're one of the very few developed countries that did not have set up, right when the pandemic began, a genetic sequencing program. And the way that very commonly works is that you look at all the samples taken across the country. The government will predetermine, we're going to do genetic sequencing on 1% of them or 2% of them. And they kind of dipstick all over the country. And then they pull up a sample, they do a genetic sequence on it, and they can actually see, is it any different? So here in the US, we have had no funding for genetic sequencing. And the only sequencing that has been done has been primarily either out of universities who were kind of interested about what was going on. And some states were doing some sequencing. So still here in the US, we are as blind as can be. Now, the CDC just started a program of sampling across the US, 2,000 samples a week, just dipsticking, trying to figure out what's going on. But that's why we still don't really have a clue exactly how many variants we might have here in the US. Maybe we have more than the 2 that have come out of California. That wouldn't surprise me, but we don't know that. And I would imagine in Canada you're doing genetic sequencing, but I don't know to what extent you are.
Yeah, I'm not really sure on that one. I haven't really looked into what's happening on that side, so I don't even want to say yes, it's going on, but I don't want to say no either. So
Well, right, right. Well, I think the thing about for all of your listeners and those of you that are thinking about when do I go back to an office, how does this impact us, is the variants really are going to be a huge issue, and it's going to be a huge issue for probably a good part of this year. They're going to continue to pop up. Secondarily, if the vaccine rollout remains to be slow, then it has lots of places it can move around. The variants have also been successful at reinfecting people who have already had COVID.
but wasn't there
So,
reports that if you had it, if you had it before and recovered, you shouldn't catch it again? So
well,
if people are catching it again, they're catching the variant?
probably more than likely, but there's a misnomer to what you just said. You will get some immunity after any infection, of course, but the question is, how long does that immunity last? And that's not known. There have been documented cases already of people getting the virus more than once. Now, did they get a variant the second time? Not sure. Perhaps in their particular case, they did not mount a very effective immune response with their illness. That's also really possible. But the variants are going to be a huge driver about return to work or how you're going to continue to look at when can I go back safely. But I think the thing that sort of ties with all of this is that it really bumps up right against people's fatigue, pandemic fatigue, pandemic anger. And here we are. Now we have another problem. And, we've been doing this for a year and many people are done, right? And I started doing a little bit of research about this when the variants first started to peak out. And there's actually two syndromes that are very interesting that we're seeing in the US that now is being really identified with the pandemic, but they come from other sources. One of them is something called psychic numbing. And it's where our brain can only absorb so much calamity, so much horror, so much awful things. And the examples that are often used is that people are horrified about a death of a child, let's say, or a death of a person. But if all of a sudden now there's another death and another death and another, we just tune it out. It's like some sort of trying to take care of ourselves. And it's called psychic numbing. And that's what many psychiatrists and psychologists are saying is going on in America, where we have, 400,000 deaths and we don't even seem to blink an eye anymore. The other one is something that's called, I want to make sure I get the title of this correct. It's actually called shifting baseline syndrome, shifting baseline syndrome, SBS, shifting baseline syndrome. And it's actually a syndrome that was originally discovered and discussed about the environment, where people get very used to all of a sudden where maybe your environment or your beaches aren't as nice, or that your forests are more degraded, or that you have certain other things going on in the environment. And people get used to it, right? It's your new baseline. So the baseline is constantly going up as the environment degrades. It's very much the same thing that we're experiencing here in the pandemic, is that we have grown used to our current situation. And then when it gets bad, we get used to that. And then we get used to the next level. And so between the numbing, if you will, and this constant readjustment of what we think is okay, at least here in the US, where our tolerance has gotten to be astronomical, which is really unfortunate. And as these new variants go on, that will even be a bigger issue that I'm really concerned about, Alex, because people are just going to say, look, I've done this for a year. I'm done. But the virus is not done with us, and it is extremely creative about how it continues to reinvent itself. And we're seeing that in many places across the world right now.
It's interesting you brought that up, because I was linking it back to what I said about the students here at the University of Guelph,
Right.
down the road from where I live. After all this time, you know, they should know better, you know.
Right.
And yes,
Right.
you know, when you're young, you feel like you know, nothing can hurt you, you know. But for some reason, with you know, even though you're seeing all these headlines with all these deaths and long-term homes having you know 50% of their patients you know dying, and you know the U.S. 400 and you know 20,000 or whatever the
Right.
number is now,
Right.
you know, all happening around you. Why would you turn around all of a sudden and just take that chance?
Right.
You
Right.
know, oh, let's just have a group of 50 people, and you end up with 32 cases all of a sudden.
Right.
You know, what's driving that?
Right.
You know, I don't understand why people would want to take that chance.
Right.
You
Well,
know,
I think there's also that that issue that it won't happen to me, right? You don't think you're going to be in a car accident. You don't think you're going to get sick. You don't think. And so I think the other thing too is I think if you look at your own behavior, let's say that you're really, really good and you don't violate any rules, and then maybe one day you decide, okay, I'm gonna do something that's a tiny risky, right? Maybe I'm gonna spend an afternoon with some friends. Hey, everything's okay, nothing happened. So then the next week you think, well, and nothing happened back then. So maybe I'm going to do a little bit more and then a little bit more until all of a sudden you're having a dinner party at your house, right? You didn't get
yeah,
there overnight. You got there in little tiny
it's that
increments of
what's that
trying.
expression? Pushing the envelope,
Yeah, totally
pushing it as
pushing the
far as you
envelope.
can, you know, until you know something ends up happening.
Mm-hmm.
You
Mm-hmm.
know, and I think a lot of people are starting to do that.
Mm-hmm.
You know, because all the cases, especially when you're looking at headlines, you're always hearing about you know such and such region has this case count. You're not actually hearing you know your own little community, your own or neighborhood.
Right.
You
Right.
know, it's like
It's somebody else.
yeah, those 50 cases. Oh, that's somewhere else. You know, and I'll use my
Mhm.
city, somewhere else in Guelph, which means I'm okay to wander around in my area, but
Right.
I'm not,
Right.
because I
Right.
could be number 51.
Exactly right.
You know,
Exactly right.
ugh, it's crazy. Regina, let's talk a little bit more about the vaccines and the rollout.
Mhm.
You know,
So here in
how,
the U.S., of course, we've had a variety of issues, and again, the U.S. government under the Trump administration really did no planning for anything beyond the creation of the vaccines, which was obviously a huge thing. But there was no funding or activities of planning really about how to roll it out. And we're different than Canada because we don't have a public health or a national health system. And so every state, everybody has different insurance. It's complicated. And here in the United States, we view public health differently than a healthcare system. And so nothing is coordinated, nothing is universal. And so it's a huge logistical problem. And so I think Biden's going to get his arms around this, but what that's meant is that we've had a much slower vaccine rollout. Here in the US, we also had a very structured way of rolling it out, which actually, from a scientific perspective, made perfect sense, right? You're doing older people, first of all, in nursing homes and people that work there, and then all the healthcare workers. And then the next after that would be people over 75 and some essential workers. And then after that, it was people over 65 and other types of workers. But it's complicated. And it's one thing to come up with a good scientific rationale. It's another thing to try and administer it. So I think what Biden's going to do is he's going to really consolidate some of those categories and make it a much easier and cleaner. Because can you imagine, how can you go prove you're an essential worker if you go to a clinic to get a vaccine? Because what do you need to bring, a pay stub or something? I mean, so it's
yeah,
crazy,
yeah,
right? It's crazy. So the first thing they're going to do is they're going to really collapse many of those categories together. The second thing that they're also going to do is that they're going to open up mass vaccination centers in many different venues, like Disneyland right now is going to be a mass vaccination center. They're training many more people to administer these injections. And then fourthly, they are just doing a huge push and education campaign. But again, they're playing catch up because they didn't
yeah.
start until January 20th, and that was only just a few days ago. So it's really the push to get the vaccine out for many different reasons. We're not going to have any possibility of a normal life, whatever that means anymore, until we get a large number of people vaccinated. And let me just say, Alex, that the number of people that have to be vaccinated is also likely going to be higher than was originally forecast. Most people believed it would be around 70% that would need to get the vaccine because of the high transmissibility of some of these variants. There's a lot of belief that that vaccine number is going to need to be somewhere between 80 and 90% in order to really fully stop it. Now, if you start getting more and more people vaccinated, you're going to have less community spread, of course, but still you're going to have community spread. And the other thing about the vaccine that's important to understand is that we do not believe at this point that these vaccines provide something that's called sterilizing immunity. Sterilizing immunity means not only do you not get sick, but you also don't get the virus incubating inside of you and you are asymptomatic and therefore able to transmit it to somebody else. There's only a very small number of vaccines that provide sterilizing immunity. And so that means you could get vaccinated, Alex, get your 2 doses of Moderna or Pfizer, let's say, and you still need to wear a mask until we really understand what's going on and the number of cases in your area go down. So you get a vaccine, you think, wow, I am good to go. Well, you're not. And so from a perspective, again, of reopening offices, many of my clients thought, we're going to get everybody vaccinated. Life is going to be good. We're just going to open up and it's going to be great. No, you're still going to be doing physical distancing. You're still going to be doing masks until we know really what happens with these vaccines when they get into people and what happens with transmission. And that's going to be time. And so even if we get a large number of people vaccinated by the end of the summer, we're still not going to be maskless for probably a period of time.
Well, every time I take the dog for a walk, every time I step out my front door, I've got a mask on, and I do see people walking in groups. And I hate to say this, but, I've seen the same group of ladies wander around all over the place, without a mask. And I've seen the same ladies with different people, and, in this neighborhood. And it boggles me. I'm going, there's no way you're all one bubble. There's no way.
Right.
You've all got houses to go home to, with either a husband, a partner, kids, whatever the case may be. There's no way, there's more. I've seen more than 10 people, 10 different people. So, and
that's too many.
Masks.
That's way too big a bubble.
Yeah, way too big. And it's interesting you mentioned earlier about the challenges with distribution. That there was no plan, from the previous administration in the U.S. Here, I think it still happens. There are regular calls between the prime minister and the premiers of the 10 provinces and the 3 territories here. I believe they meet monthly to have a call to see what's going on, what are your challenges. And there are continuous, every day, especially in my province, updates from the premier himself, not just a doctor.
Oh, that's great.
You don't always agree with everything he says, let's face it, but those have continued every day. And I believe that happens in every province. So that they're all staying in touch with each other on some level. Doesn't mean they always agree about everything, but they're staying in touch. And I don't see that. I can't see Michigan on the phone with Texas, or on the phone with California. What's going on? How are you dealing with? I've not heard of anything like that happening down there.
No, the only thing that there have been at the beginning, there were coalitions of states that touched each other, like New York, New Jersey, for example, or in California, it was, California, Nevada, Oregon, Washington. But I don't even think those exist anymore. I think everybody's sort of one man, one woman for themselves. And that's not particularly helpful either. I think that the message, for all of your listeners, many, of course, in continuity planning and thinking about what this means for them going forward, is that many of my clients were thinking about that they would be going back to the office by the summer. And I think that based on the variants and the unknown, that's not going to be feasible. Most of my clients have extended their view now to the fall, or for that matter, even the early or late winter. So we're talking end of 2021 or the beginning of 2022. Oh my gosh. So I think the other thing I would say to you is that from a perspective of reevaluation and reinvention, companies are now really more digging into thinking about, what does this mean for us? You know, if you've been working at home, Alex, for 10 months, a year, and maybe you're going to be working at home for a year and a half or two before we actually have this under control, then you'd have to say to yourself, well, what does going back to the office mean? And this is the question that I've really been asking my clients to tell me. Why are you going back to the office?
And do people even want to go back now?
Right, right. And I think there's a chasm that's beginning to develop. And I have I talked to an executive on Friday last week who was saying to me, but Regina, I don't know if, are they really working the whole time they're home? And I said, look, okay, this is the deal. Office workers, people who are white collar workers, we often don't have a true list of deliverables. Like, people that are in a manufacturing facility, your boss knows how many cars you touched, how many widgets you made or whatever. But in a white collar office environment, they don't know that. And I said, I think what I would ask you to be thinking about, and this can even go back to thinking of continuity plans, et cetera, is that what's the deliverable? What does that person do in their job? Because in reality, that's what you need to understand. If they're able to do their job at home and it works, then the question is, why are you going back? So that's the question to ask. Why are you going back? Mm-hmm. And you might say, okay, great. It's really important because we need to do collaboration. We need to do, whatever. We need to get together and do group meetings. And for certain things, it's much better for there physically. Great. Do you need to do that 5 days a week? So I think what I'm saying is
and how were you doing it the last 10 months?
Right. And so I think it would be crazy for people to go through this entire experience and then just go back and do it as they've always done it, because that's what they've always done. If you've gone through something for a year plus, I mean, Alex, wouldn't you change your behavior? Stop and think about it, right?
Yeah.
So I think, and I actually, before I joined your call today, I was just having a really deep conversation with one of my clients about this very issue, and their coronavirus task force, if you will, who's been monitoring the pandemic at their company. I said, look, I advocate and have you think about, what does it mean to go back? And this is a role I think that continuity planners can also really be helpful at, because we know what's going on. We've documented these plans. We're very clear about this. How can we kind of raise the bigger question, do we have to go back full time? And I would say to you that the vast, vast, vast majority of offices could say, I think we could do a hybrid thing. Maybe we're going to go back a day or two a week. Maybe we're going to create a whole nother way of working. Maybe we're going to shrink down our office footprint. Maybe we're going to, this is the time right now, because things are so uncertain, and they're going to be uncertain, Alex, for months. It's a time for us to be thinking about a bigger picture here. The bigger questions is what I'm really asking my clients to think about.
Well, it's interesting. You mentioned, this executive saying, how do we know if they're really working at home? Well, how do you know they're really working in the office?
Right. They're just sitting there.
Are you micromanaging? Is your head literally on the cubicle wall watching everything they do? Following them around? No. I find myself more, it took a little bit of an adjustment, but once I got used to it, I found myself more productive at home because I had less interruptions. Yeah, I missed some of the chats and everything, but that's what Zoom is for, or some of the other applications that are out there, or a novel thing that they used to have, which most people don't seem to have anymore, telephones. Yeah. Where you can
what's a telephone?
Exactly. You can talk to people. So it's interesting that they would think that way. Well, how are you doing it now? What a question to ask.
Yeah, I think to me, it's really an opportunity and a time for reinvention. And that's what I really think that we all need to look at. The other thing I would say to you is that when you're really clear on deliverables, then, does it matter, Alex, when you work, if you get your job done, unless there's a requirement for you to be doing during the hours of 9 to 5? Because think of everybody that still might be homeschooling. You know, if you can do your work between 12 and 4 o'clock in the morning and you get everything done, what difference does it make? And so you get paid for 8 hours and you got everything done in 4? Good on you, right? I mean, that's part of the issue is I think we are asking bigger questions now. We need to be thinking about this beyond this moment of, oh my gosh, we have to get back to the office, because I think that's not true. The other thing I would say about for our continuity planners is this gives us a great opportunity to go back in and really make sure that we have clear processes. You know, our SOPs are clearly laid out in our continuity plans, that we've really, I mean, there's a lot of great work that's been done here, and we need to make sure that it's documented and not lost in how we can recover businesses. Because you could have a situation in Canada, as I could here in the United States, where you have some big widespread power outage. We're all working from home. Then what? Right? So we still have lots of things we should be thinking about right now from a perspective of how we can continue business, even though we're doing a great job for the most part in our home environments.
Now, there's a scary thought. I know we've only got 2 minutes left. You mentioned big power outage. Can you imagine right now with everybody working at home and experiencing that power outage back in 2003 on the?
Well, you know, exactly. Yes. And
that?
what I would say to you is we have done a variety of I've done, normally I do about 100 exercises a year. This year I've only done about 50 because of the pandemic. But I've been trying to focus on topics like that. Everybody's working from home. We have a power outage, we have an earthquake, we have whatever it is, and it's a regional event. People can't just get in a car and go someplace easily. That's a really good exercise topic for many of your listeners to be thinking about, because that's a possibility. You know, what happens when you have the first event and now you have a second disaster, and how do you recover that when people are working from home?
And on that, we've come to the end of our January update with Regina Phelps. You know,
hopefully I'll be happier or cheerier in February, but don't count on it.
well, yeah, I was going to say I'm not going to put any money down on that one. Just not with the way things seem to be going, and who knows?
Right.
There may be more students in my area being silly, so who knows? But thanks again for your sharing your time and all the updates on COVID and other things, all the questions, especially with that going back to the office piece. I think a lot of people are going to be rethinking their plans over the next little while.
Mm-hmm.
You know, so thank you once again, Regina. And I know we'll
As
be
always,
talking in 4 weeks again for our next update.
Yeah.
And to everybody listening and everybody watching, stay prepared, everyone. If you liked that video, thumbs up. If you didn't like that video, thumbs down. But leave a message and let me know what your thoughts are. If you'd like to be a guest on the show to talk about something related to business continuity, disaster management, COVID, personal well-being, anything that's relatable to those subjects, you can reach me through my LinkedIn profile, which is in the video description. And of course, don't forget to subscribe. In the meantime, stay prepared, everybody.